Bringing Your Family Practice into the 21st Century with Dr. Bob Patterson, who is a medical doctor and a naturopathic doctor. And he practices in Sanford, North Carolina. He has a practice that's called Back to Basics. And so Dr. P, I'm going to call him Dr. P for short. Can you tell us what made you decide to choose family medicine as your specialty?
Okay. Believe it or not, I wanted to be a family doctor since I was probably about 6 years old. And I think my great-grandmother is what sort of pointed me in that direction, and had an opportunity to work with my family practitioners that I grew up with. Actually went with them on house calls and things like that. And so I loved it. And so I just always aimed for that. And then when I got in medical school, I liked it because you see a variety of patients and you can help a lot of people. And it was during medical school and actually interviewing for residency that I found that family doctors could take care of about 90 to 95% of everything that walked in the door. And you can sort of see from the next slide that family medicine sees all kinds of things. And so you not only saw, they used to say you'd see people from the cradle to the grave. You would help people at birth. And when I first started, I actually delivered babies as well. And you help people in their final days as well. One thing that I got interested in during residency was the urgent medical needs. People, if they have an urgent need, they go to their family doctor. Now that a lot of times they go to urgent cares or emergency rooms. But for the first 20 to 30 years of my practice, they would come to us. And I've been in practice now for about 42 years, I guess. And the urgent care part of the medical practice is what really got me interested in the Sumis medical laser. But I love family practice and what we can do with our patients.
So that's a perfect segue, because you're using the Sumis medical laser. And so for all of our doctors who are watching today or participants, it could be patients as well, we wanted to explain what the laser does. And we're going to start with some basic science. We're not going to stay here too long, but the laser does something called photobiomodulation, and that is using using red and infrared light to target different parts of your body, the melanin, cytochrome C oxidase, hemoglobin, and water. And as it targets these parts of your body, it helps to increase your circulation, it brings more oxygen to your tissues, and it helps your cells produce more energy. So really, you're stimulating your body to do its own healing. And so I kind of just said what it's doing, right? But what is it really doing? What does that mean for Dr. P's patients? It means we're reducing pain, we're enhancing tissue healing, we're increasing circulation, and we're resolving inflammation. And so the exciting thing we're going to do today is we are going to talk to Dr. P about all the different patients that he is using laser for, because the amazing thing is, because you're focusing on reducing pain and inflammation, there are so many different ways you can use it. So this webinar is going to explain to you how Dr. Patterson is using class 4 medical laser in his practice. So we're going to share a couple of stories with you, and we're going to start with a case study of TW. And TW, I'm going to pass it over to you, Dr. Patterson, to take it away.
Okay, thank you. And let me say, to start off with, my first experience with the Sumis laser was actually from my wife. We were at a medical meeting and she had an ankle injury, and we saw the laser and we were encouraged to try it. We tried it and she was just amazed at what kind of results she got. And I think I played with the idea for a long time, actually bugged Rachel quite a few times. I think she's on the webinar, and finally got started with it myself. These cases are just examples of a few things that we have just been amazed at, and it's some of the things we do with it every day. The first patient, TW, is a 36-year-old male who's a contractor, and he came in with pain. And it's interesting, he was riding a four-wheeler up a river embankment and got hung in a root, and he decided to jump clear of the four-wheeler, which he did. And he rolled to the bottom of the bank. And when he looked up, he saw the four-wheeler coming down. and it landed on his face and head. And he was life flighted from the site to a local medical center, where they saw that his maxilla on the right side was broken, as was his mandible. He had a blowout fracture in his right orbit. His frenulum was torn, his lip was torn. He looked like somebody had just been beating him in the face. He was so swollen. He was miserable. And I guess the thing that concerned him and concerned us is he had a past problem with opiates. And so he really did not want opiates, but he needed something for the pain. And so they basically told him to take anti-inflammatory medicines, ice it, and needless to say, he was pretty uncomfortable. A couple of days into the injury, he came to see us and basically was just wanting some relief from the pain. And as Betsy said to start off with, the neat thing about these medical lasers, they're class 4 surgical instruments, and they do reduce pain. And you get some inflammation reduction just because it improves the circulation in the area, it gets the lymphatic circulation going, decreases the edema, the bruising. And anyway, we gave him treatments, and after his first treatment, he noticed a lot of relief. And he's not somebody who would want to just come back, but he's scheduled to come back 3 times a week for a couple of weeks. And at that time, he basically had no pain, minimal swelling, which was amazing concerning all these fractures. And when he saw the surgeon who had seen him initially, the surgeon was amazed and really said that he felt that the healing time had been at least reduced by 50%. Oftentimes we see it better than that, but he got a lot of relief. He was very happy with it. And this was without him having to take any kind of oral medication at all.
That's amazing. I do want to point out one thing. I think when we talk on automatic, but sometimes we use the wrong word. You were saying a surgical laser. And so it's a medical laser, but it's actually therapeutic. And that's something that we like to call attention to, because a lot of times when people think laser, they think surgery, they think ablative, but what we're doing is completely different. We're doing therapy where we're stimulating the body and helping it heal. So just jumping in there. Okay, so we're gonna head to our next case, which is DS. And here you go.
Okay, DS is a 30-year-old Hispanic female who's struggled her whole life with some pretty bad acne. And the day that I saw her, she actually had pretty much, as you see, some cysts, and they were draining pus. I mean, it sounds sort of gross, but she's just gotten used to this. And I had a physician that had said laser, the class 4 laser really seemed to help with a wound like this. And so what we did is we went ahead and treated her with the laser, and within 24 hours, the large cysts, the ones that were draining pus, were totally gone. I know that sounds unbelievable, but it's amazing. We've seen several other people with acne, and they come in and are interested in like a chemical peel or aesthetic lasers, which is a different kind of laser. But when it's inflamed like this and draining pus, you can't do anything else for it. And at this point, medication for acne isn't going to help either. This gave and does give relief and results in 24 hours. I didn't believe it, but I've seen it many, many times, and it does work.
I was saying earlier that I would love to have had this for my stepson instead of taking some drugs with some strong side effects. So yeah, it's really good to know. Okay, so we're going to talk about LE, and before we get any further, I'm just going to point out to everybody that our pictures are really for illustrative purposes, because clearly this lady's not 6 years old, and I don't want LE, if she happens to be watching, to think that we were saying this is actually her. But I had to illustrate what Dr. Patterson's going to tell you.
Okay.
Alrighty.
Okay, Ellie is a 60-year-old lady who's in retail sales. And sort of like this lady, she was loading up her trunk. And the car was on a hill, and it was not in park. And it started rolling backwards, and it knocked her down and ran over her. She knew that there was a bad problem. It ended up she had a broken neck. C5 was broken. She had a dislocated right shoulder, definitely a rotator cuff sprain or strain. She had 5 fractured ribs right at the sternocostal margin. Needless to say, she was very, very uncomfortable. And so she came in to see us. She had actually been to the hospital. They put her in a cervical collar and gave her medication for pain, and she was having no relief at all. It hurt her to breathe. And so she came in to see what we could do for her. I felt like she was a perfect laser candidate. I had somebody tell me one time that they had used the laser on a rib fracture, and we had tried that, and it was amazing. We took the pain away after one treatment. So with her, we did the laser 3 times a week, and first couple of weeks, she noticed, immediate relief. After the first treatment, she said that her pain was probably decreased by 90%.
Wow.
And by the second treatment, it was pretty much gone. And we're talking about the pain that was in her neck, the pain that was in her shoulder, and the ribs themselves. Within, after the second treatment, I guess, the range of motion in her shoulder was completely back to normal, and it was pain-free. And her ribs also, she was having no pain there. So she was having no problem breathing, coughing, sneezing, laughing, or anything like that. The neck was a problem because I never treated a broken neck with a laser. But in talking with the neurosurgeon, he had told her initially that she would be in that collar for at least 4 to 6 months. When she went back for a recheck at 2 months, the cervical collar could come off. He said he had never seen someone heal rapidly like that, especially in a 60-year-old female where you see bones sort of washed out oftentimes. So she was out of the cervical collar and back to work, full duties. So it was amazing.
2 months instead of 6 months. That's phenomenal results. That's amazing. Okay, we're going to talk about KO.
KO's a 38-year-old housewife, and she had been changing a light bulb or something and had fallen off the ladder and landed on her butt. She had a lot of pain, went to the emergency room. They basically said they didn't see anything wrong. Still misery, just a horrible pain. Went to an orthopedist. He said she probably just was bruised. And after about 6 weeks, we saw her, and she had a hairline fracture in her left hip. We decided to try the laser, and she had failed.
Before you get to the laser, you might want to share her proposed treatment and what she was told.
Yeah, she was told that she would have to use, Percocet or one of the opiates for pain, which didn't help. And she'd been trying that for several months. She was told that she could not bear any weight on it at all. So she really couldn't get around. She couldn't take care of her house, or her husband, or anything else. And so it was, she was just devastated. And we actually saw her for another reason and saw that she was uncomfortable and asked her, and that's where we got this history, and said, well, why don't we try the laser and see how it does? And so she ended up getting, I guess, 10 treatments. But after the first 2 treatments, she had a 90% reduction. That's her word. She went from a pain of 10 to a pain of 10, a pain of 10 to a pain of about 1 or 2. And she actually was comfortable after the 2 treatments, but she felt they had done so much. She went ahead and signed up and got 10 treatments. And the surgeon who saw her, who had told her she'd be not being able to bear weight at all, was amazed that in a month she was healed. The fracture, there was no evidence of it on MRI.
So yeah, again, speeding the healing process. And she was told by somebody else, just there's nothing you can do except for not put weight on it. And really you were able to solve that right away for her. That's like amazing.
It was.
Okay. I love this one because we were talking about some older people in my generation and things they experienced, but this is a younger guy. Let's talk about AR.
AR is a 15-year-old soccer star and loves to play soccer. And like a lot of kids that are very active, they'll develop Osgood-Schlatter's disease, which basically is just an inflammation over the tibia. and you'll look and you'll see a little knot on their leg. It's very tender. And pretty much the sports medicine person that saw this guy in consultation, the school sent him directly to them. Said you can't do really any activity other than walking around. You're going to have to use anti-inflammatory medication, and you use ice, and it just takes tincture of time. It eventually will go away. And we were doing a sports physical and noticed that this was a problem. And I said, well, let's just try the laser. And over a week, we did it Monday, I guess 3 times that week. The student was really amazed because after one treatment, it was gone. The pain was gone, and it never came back. He was not doing anything else at all. He did wait, and as far as return to sports, for a couple of weeks. There's still some inflammation there, but the pain completely was gone. Any limitation to activity was gone. So we turned them into a believer really quickly.
That's good. And he got to play more of the season versus missing the whole season, right? And I know when you have boys, it's good to get them out on the field and tire them out. All right. So EO is our next person, our next case.
And EO is a 72-year-old male who is a retired businessman. And he had left-sided chest pain, sort of the dermatome, the T3, T4 dermatome. And, when a male this age comes in with chest pain, of course, you think of heart and all that kind of thing. And he was checked out in the emergency room and told that, there was not a problem. Then all of a sudden, he started developing a rash. And when we saw him, he had a severe rash, gone to, back to an urgent care. They felt like maybe having contact dermatitis. They didn't put the 2 and 2 together. They put him on some steroid cream. And another ER urgent care visit, put him on an antiviral medicine because they said, it looks like you've got shingles. So at this point, the treatment had been sort of scattered and delayed. He was very uncomfortable. And when we saw him, we said, we'll try the laser. And we did the laser one day and then the next day, basically just 2 treatments. And pretty much the little blisters that you saw or that you typically see with shingles, they were dried up. Now, granted, he had been on a couple other things, but when we saw him, it was very active, very uncomfortable. And not only blisters dried up, but the pain was gone. The class 4 laser, the stimulus laser, there's a neuropathy program, which I know this is not what we're supposed to get into, but we saw such things as this happen. So my whole staff went to the neuropathy training program that SUMA sponsored, Dr. Greg Lewis. And it's amazing to see, he touts like a 90% success rate with neuropathy. And it certainly worked with this patient with their shingles neuropathy.
Yeah, it's very effective. I have a personal case study on shingles as well, so I can attest to it. So let's move on to RP. He is male and 27.
And he's a carpenter. And as you can imagine, with a carpenter, he's constantly using a hammer, and he develops some elbow pain. And when you develop elbow pain, I think everybody knows that it's going to be what they call epicondylitis. And his was on the side of his arm, which basically means lateral epicondylitis or tennis elbow. And he had actually been suffering with this for about 9 months. He couldn't stop doing what he was doing. He'd been to 3 orthopedic clinics, urgent care clinics. He'd gotten a cortisone injection. He'd been told to use ice, told to use heat. He'd had an MRI. He had had a CT scan. He had x-rays. I mean, he knew what he had. Everybody else did too. One orthopedic surgeon told him that, you have not succeeded in taking this away, so we're probably going to have to operate on you. And we saw him for unrelated problem, but noticed he was having the elbow problem. And then I got this history from him. And I said, let's just try the laser. I said, you'll be amazed. It's, just a 2 or 3 minute treatment. And we did 3 treatments, and his pain was completely resolved, and it has not come back, and he has not stopped work. He was amazed. He sent a couple of his buddies to be seen by us for the same reason. But it is amazing. Talk wow factor. It definitely has a wow factor.
There's that word of mouth referrals that we love, or you love, right?
Right.
So CB is our next and last case.
Okay, CB is a 60-year-old male who's an auto dealer. He's on his feet a lot, and he loves to run and has run since he was in college. And all of a sudden, he was starting to have more and more difficulty with pain in his knees. He had seen orthopedists, and orthopedists basically said, "I think your running days are over. You've got bad arthritis. You're really not bad enough that we need to replace it." They had tried some injections. Nothing really helped. And so they pretty much said, you just can't run anymore. And we saw him. He's also a pilot. And we saw him for a pilot exam. And I noticed that he was, having some difficulty. He told me the story about his knee. And I said, let's just try the laser and see. He was very, very skeptical. He was treated 3 times. And he said, I was actually able to run. He noted that the pain came back the next day, but not as bad. So what he did is he started getting treatments and liked it so much, he decided that what he would do is, buy the package. And then if the pain came back, he would come back. Well, the pain did not come back. His running back to normal, running several miles a day. But he decided to come back on about a monthly basis just to get a treatment. Since we talked about how, it improves the circulation of the area, the stem cells and all this kind of thing. And he decided that he would do it as long as he could do it so he could maintain his running.
So it's like a prophylactic treatment, right?
Yes.
Yeah, right. Okay, awesome. I love hearing those stories. And I think a lot of what you're going to say to my next question is pretty evident after what we've talked about. But how can a family practice and their patients benefit from a class 4 laser therapy?
I think there's, as we've talked about, the pain. This day and age with, opiates being really, under the pressure of, not using them. And also people seeing that they really don't work that well. And there's a lot of risks and dangers. There's not a lot of things that, family practices or anybody else for that matter can offer to help patients with pain. And oftentimes patient comes, if you remember the very first slide we showed, they come for pain relief. They need something to help them, whether it's their arthritis or it's their tennis elbow or whatever. And so the laser helps a lot with pain management and getting people back to their normal life and normal lifestyle.
Yeah.
Second thing it does is it speeds healing. I've been amazed to see, like, the lady that had the acne, it cleared that up really quickly as far as the drainage. But we've seen other wounds, we've seen bruises, we've seen lacerations, and just from with what the laser does by increasing blood flow in the area and increasing the fibroblasts and all the other chemical fantastic things it does. Yeah. It allows us to really speed up healing. As an aside, I know the laser's been used in a lot of different areas of medicine, including veterinary medicine. Mm-hmm. And I've got some patients that are veterinarians, and I ask them, do you use your laser much? And they said, after every surgery. And I said, why? They said, because it increases healing time 10 times. So, and it does speed healing. And the most important thing with pain and healing is that the patient gets some comfort. So many times, emergency room, urgent care visits, patients go to find out what the problem is, and they're told, that what the problem is or is not, but nothing much is done for it these days. And so this is something that allows patients to have comfort, and it gets your patients satisfied. And we get a lot of word of mouth referrals because of that. I think I recently posted something on laser and just how it can be used, but that's the first thing I've posted in probably 6 months, because word of mouth is the best advertising, I think. Patients
that's interesting. Well, if you'd like to post more, we have a whole bunch of new posts we can share with you. And so I think the final point is a big one.
And it has grown our practice a lot. We started out using laser, and Rachel can correct me if I'm wrong on this, but it's about 1.5 years ago. And within about 3 months, we were essentially able to make payments on the laser and pay for the laser. As a matter of fact, in less than a year, we got 2 more lasers. And the reason is we oftentimes found that the people waiting in our waiting room were waiting for their laser treatment. And our laser was staying so busy, we got additional lasers. The nice thing about it is I believed in having my entire staff trained. That way, not only would they know what the laser did, but they would know who was an appropriate candidate as well, so that it could even be suggested or they could answer questions. But the laser is something that your staff can administer. They get a chance to spend time with the patient gets time to spend with the staff. It's been a sort of a real good marketing ploy. I hate to say that, but
nothing wrong with being marketing. As a marketing director, I can say that.
Well, it has helped. And the patients love it. And it also increases the options that we have for our patients.
Right.
It puts more in our toolbox of things we can use. And I think we talked at one time, I can almost see a purpose or a reason to use the laser in probably 90% of the patients that walk in the door.
Right. I hear that too. When you're seeing them for something else, you're noticing the pain and seeing an opportunity to bring healing that they haven't even thought to ask for, which is amazing. I'm just going to summarize this because I think it's amazing. So 1.5 years ago, you got your first laser. It was so successful that you had people waiting for it, so that you didn't just buy 1 more laser, you bought 2. So you've got 3 lasers and you're keeping them busy. And lasering everybody and finding new things you can laser all the time, it sounds like.
It's amazing. It's amazing.
Yeah.
I know that this is a brief seminar, but I know Sumis has come out with a dental laser now too. We've been using it on TMJ, which normally you can't do much for it. I mean, right. There's so many things where you can use this in your practice and make people happy and comfortable. It's a win-win.
It's a win-win. I love that it's a win-win. And so I know that I'm the director of marketing, but we do have some people here watching us. So I have to put on my sales hat for a minute and ask the people if you're interested in how about taking a test drive. Okay, so we can come to a demo to your office with your patients and show you the laser in action, and your patients will be amazed. I've actually had several doctors tell me that the patients love it so much. They say, like, are you going to get it or aren't you going to get it? So, I mean, when you see that kind of patient interaction, it's the real deal. So if you are interested, all you have to do is in the Q&A stream, type interested, and we'll have somebody contact you. And that's all the sales we're going to do. And I will tell you, and I think Dr. Bob will say this, is your practice will never be the same, right?
You're right. And, to add to what you said about the test drive, I encourage folks to do that. I've actually taken my laser to another doctor's office to just let them try it themselves, but also on some patients. And the patients are amazed and the doctors are amazed. I mean, it's worth a test drive. Rachel came into our office and I mean, it really sold us.
Yeah. And I know you said you thought about it for a long time before you decided to get one, but you're thinking, why'd you think about it for so long, right?
Well, I think I was afraid of just the financial, outlay. But I was amazed. Rachel was so patient with us. She came back 10 times, I bet, to talk to us, answer our questions. Sumis was able to help with, arrange financing with a good company, which allowed us a chance to get the laser into action and working and earning money so we could pay for it. And I, of course, have been told that would happen, but, again, you just don't believe it. And all of a sudden, it just all falls into place.
Well, and that's why it's so important for us to have you tell somebody, like the salespeople told me I could pay for it really easily, but to actually see it in action and do it is a completely different experience. So,
exactly.
Right. So I love hearing that feedback. All right. Well, I am going to sort of, wrap this thing up. But before we go, I'm going to thank you so much. And I'm going to tell everybody we are opening the webinar for questions, and we'll take a few before we close. And let me see. Oh, okay. I think I'm going to know the answer to this one. Somebody asked, do you feel like you needed a ton of marketing, or was there a lot of word of mouth to get your patients asking for laser? I feel we answered that, didn't we?
We did answer that. It wasn't a lot of time at marketing, but let me say that you guys at Sumis, you provided us with anything we needed, but we didn't need a whole lot. We put brochures in the office. I think we put a couple of posts on Facebook and things like that, but most of it, and I'm talking about 90% of it, was word of mouth. Patients telling other patients, people telling neighbors. I guess I ought to look sometime and see how many new patients we got just because of this.
That's an interesting
But
question.
it's a substantial number.
Okay. So this is a little bit longer of a question, but it says, have you ever tried to help diabetic or pre-diabetic patients in controlling their blood glucose level? I saw a study about that, and I tried it on myself as a pre-diabetic using a P4, and I've had marvelous results. Her HA1C decreased from 5.9 to 5.5 in a month. Do you have any advice on this?
Sorry, I probably don't. We have used it with diabetics that had diabetic sores or ulcers, lesions on the skin, other aches and pains. And first of all, we've not had any problem with that. It's actually, healing has sped up amazingly. But I haven't tried it with trying to manage the diabetes. That's interesting.
I was going to say too that we have an amazing protocols for peripheral neuropathy that is often caused by diabetes, right? So what we're talking about, the peripheral neuropathy, and then the sores you're talking about are really the effects of the being diabetic. But I love this question because it's saying, hey, can we do something before they get to that point in managing their diabetes? So
Good
yeah,
question.
so maybe you can be on the lookout for some pre-diabetics and report back to us.
You definitely will. And, as you mentioned, the neuropathy, for a long time in medicine, we felt like there was nothing you could do for neuropathy. I mean, you can use drugs, which make them feel awful and oftentimes don't do very much.
They just mask it. They don't take care of it. And the laser for neuropathy is phenomenal. I don't have another word for you. I mean, in 16 treatments to take people from not being able to walk to walking is giving somebody their life back. But that's a whole nother webinar.
Lots of little stuff is that you can get a 90% success rate with your chemotherapy-induced neuropathy or diabetic neuropathy.
Right.
And I can confirm that.
Yes. All right. I'm glad. Okay. So we do have another question. Are you able to bill insurance?
You can bill insurance, and there are CPT codes that are available. I guess I should give you a disclaimer about my practice. I stopped billing insurance for anything about 12 years ago. I just felt like insurance was imposing themselves between my patients and myself. And so we stopped completely. But I do know that there are practices that are billing insurance quite successfully. And as you know, lasers are a big thing in medicine these days. And so there are CPT codes available, and it just depends on the insurance company. The coverage varies with the insurance company.
Yeah. The one thing I want to point out is that we have practitioners who are like you. They're all cash-based. No, they don't take insurance at all. We have practitioners who are all insurance-based, and then we have people who are hybrid. Like they bill insurance for some things, but they keep their laser as a cash-based service. So we have providers who do it any which way. I think whatever they feel is most successful. And I will point out that one of the things we do when we train you is that we train you how to sell a package and how to communicate to your patients the benefits and to really engage them. And I hear the success rate of people signing up is phenomenal, especially when it comes to neuropathy. There we go, back to that other webinar. And
I'll also say about your training. I've taken my entire staff. I went to a training program, loved it, took my entire, not only provider staff, but also all my staff, front office, back office, everybody.
Yeah.
Y'all's training is awesome. It's very helpful. The support from Sumis has been wonderful. I can ask a question and have it answered in less than, probably a few hours.
Yeah. That is something to note, is that we have medical directors who are available by text, by phone when you need them, and they're amazing.
They are. They
Yeah,
are.
they sure are. And our sales reps who do your initial training are also terrific. I'm going to point out too, we also have, in addition to coming to your office and doing a demo with your patients, we also have the option to do a demo virtually. And it's not just a Zoom call like we're doing right now. We actually have a full-on broadcast studio where we can have our doctors come in and join, as well as our presenter, and you can see it in action. So it's but a lot more comprehensive than just a Zoom call like we're doing right now. So I have another question, and they said, if you're doing cash, what would be an example of package fees?
I think different people do different things. I'll tell you what we do. A lot of times we'll say, let us try this, and we'll charge $25 or we'll charge nothing. And they love it so much that then they will buy a package. A package, we typically will say, if you just want one treatment, it's $65. If you get a series of 5 treatments, it's $60 each. If you get 10 treatments, it's $50 each. Mm-hmm. So basically, it's a $500 for 10 package, and about $300 for a 5 package. Right. So it gets cheaper the more that you get. And I was honestly surprised. I mean, in family practice, we don't typically sell things by packages, but people got relief and they wanted to buy packages. And so we have, I bet, over half of our people buy packages for laser.
Yeah, that's so great to hear. There are a couple more continuation of these questions about specific codes, et cetera. So I will email or have one of our doctors email you directly to our people out there. But I think it's time for us to wrap it up. And Dr. Patterson, I thank you so much for sharing all of your experiences with us, or some of the greatest ones, right? Because I know there's been a lot more. And I'm really excited about the laser being in family practice, and I hope that it is something that that we're able to do more of, because the laser is so successful in helping so many people with so many things. It's really wonderful, and thank you for pioneering this for us.
Thank you for letting me be on and sharing my experience.
You're welcome. All right, have a wonderful day. And to all of our viewers, we will be putting this onto YouTube in just a couple of days, and we will give you a notification when we do that. Thanks so much, and we will see you soon.